with a lot more traffic about to get moving across the border on November 8th as the U.S. welcomes fully vaccinated Canadians, those with mixed doses are welcoming this news.
I'm thrilled, that finally we have some resolution and some clarity about that. I only wish they could have done it sooner.
Snowbird Ingrid White is one of the millions of Canadians who got shots of 2 different vaccines, either AstraZeneca, Pfizer, or Moderna, providing them protection against COVID-19, but leaving them in limbo for any future travel south of the border, with the U.S. Centers for Disease Control stubbornly refusing to recognize mixed doses as a means of full vaccination. That view abruptly changed with this statement. While the CDC has not recommended mixing types of vaccine in a primary series, we recognize that this is increasingly common in other countries, so should be accepted for the interpretation of vaccine records. In other words, the U.S. will consider White and others like her properly double-dosed. She and her husband had booked a trip to Florida for November, but canceled amid the uncertainty over mixed doses.
And now that the borders have been opened again, I think we're going to we will change our plans back again.
That other outstanding issue still lingers, though. Canadians hoping to make even a day trip stateside will still need to have a negative PCR test no more than 72 hours old to return home. Canada's top doctors can't say yet whether that will remain when border restrictions ease.
It's a live issue right now. As always, we continue to look at the scientific evidence and the results of our current testing regime at the border.
The change of heart from the CDC comes after what Canadian public health officials described this week as a full-court press trying to convince their U.S. counterparts that people from this country with 2 different doses should be considered fully vaccinated. It'll be one fewer hurdle to cross the border in less than a month. Thomas Dagg, CBC News, Toronto.